Dopamine promotes wakefulness, but also plays a role in sleep. We have D1 receptors and D2 receptors. The key wake-active dopamine neurons are situated in the VPHE, which is the ventral periaqueductal gray. And these D1 receptor activation, they are excitatory and therefore enhance wakefulness. On the other hand, D2 receptors stimulation in the cortex will stimulate wakefulness, whilst D2 action in the striatum, particularly caudate, this actually promotes sleep. In fact, the caudate plays an important role in promoting sleep by reducing hyperarousal. Thus, dopamine in the extrabasal ganglia circuit or extra-striatal circuit promotes wakefulness. This network, of course, also may be responsible for the arousal effects of psychostimulants. Dopamine has a circadian-like activity as well. As we saw, the retinal ganglion cells have dopamine neurons. One of the most fascinating aspects here is that activation of the dopamine system during sleep is linked to the emotional and hallucinatory aspects of dreaming. Dreaming is mediated by the mesolimbic dopamine release, which plays an important part, or a crucial part, I should say, in reward experience and motivational drive. Dreams, therefore, can be considered as a reward state. Interestingly, the concept of sleep as a reward has similarities with the psychoanalytical dream theory, which Freud put forward, which was really the theory of wish fulfillment, with motivation acting as a significant contributor to dreaming. Freud said, psychoanalysis is founded upon the analysis of dreams. He also said, since a dream that shows a wish as fulfilled is believed during sleep, it does away with the wish and makes sleep possible. According to psychoanalytic dream theory, dreaming occurs because unconscious infantile wishes, which are easily suppressed during waking, become active in sleep. When the ego is off duty, the id becomes unruly. And interestingly, when we think about the ego and id, and of course this particular quote was put forward by Hobson, but essentially ego can be considered as a prefrontal cortex. The id is the mesolimbic system, which is active during dreaming, the emotional arousal part of the brain, but also the motivational and the reward part of the brain. Further evidence that dreams may indicate a reward experience underpinned by a motivational drive comes from studies of individuals with sensory and motor impairments. And this is really, really fascinating. Individuals who had paraplegia since birth walked, ran, danced, swam, bicycled, skied, gardened, and played basketball, which indicates possibly a cerebral walking program being reactivated during sleep. And this is linked to mirror neurons. Most dreams of individuals who are deaf, there is evidence that they do not contain sensory limitations. Many patients speak in their dreams, and others can hear and understand spoken language. Individuals with blindness report visual images in dreams. Up to 21% of individuals with congenital blindness report some visual impressions in dreams when they have light perception. Individuals with amputations continue to dream of being physically unharmed, even years after the amputation and even when the physical disability is congenital.